Good day, folks. Alfie Venta here once again at Venta Pain Relief Clinic and VPRC.ca. I'm hoping you're having a great day. So now we're back onto another soft tissue case study. I call this Take a Hike Pain Part 1. So some of the key words to acknowledge here are Thoracic Outlet Syndrome, military brace, absence, and trigger point. So I have to admit that this is one of those cases where it seems fairly obvious for many therapists that have dealt with these type of cases, but for some it may not be. So let's get on to the case. So your patient client is an avid hiker who is currently suffering from pain across the right clavicle to the bicep, into the medial border of the scapula of the right side, and referral pain down the right arm into the hand. So by the way, this is one of those things where I strongly recommend that you either watch the video a few times or at least write some of these notes down, so it can help you diagram out, potentially things such as the pain patterns, and I think it'll be helpful. Remember, this is part 1. Part 2 is the answers and discussion, and we talk about the case in terms of, the outcomes, in terms of the observations, how we got to certain points, so on and so forth. He mentions to you that he recently returned from vacation and had been hiking daily for miles at a time for a couple of weeks in one of the national parks. He states that he thinks that a large part of the reason is that he had been hiking with a 50-pound backpack every day at 5 miles a day. He's decently fit and works out. So this is very important, carrying that 50-pound backpack at 5 miles a day. This is the first time doing this sort of hike. His hikes are generally over a weekend, and typically his frequency is at least 2 times a month. So he goes 2 times a month to go hiking on the weekend. But relative to what he normally does and what he has just recently done, there's an increase in volume in terms of the activity of hiking that he's doing. This is also the first time he has noticed referral pain down the arm. So as I stated about the 50-pound backpack, this is very important in terms of relative terms, relative activity level for this person. It is low throughout the day, but there seems to be certain motions, activities that exacerbate his condition. For example, when he attempts to wear his backpack and after a long hard day working in front of his computer as a computer engineer, symptoms seem to spike. So when I say low grade, I'm saying that this person doesn't necessarily not have symptoms, but they do have symptoms, but it's very low grade, and it seems to spike whenever they do these particular activities. In fact, I have to add that it's gotten worse, it hasn't gotten any better, so that's another key point that you should take into account. So now let's talk about the key observations. But before I go into the key observations, if you like our content, please like, share, subscribe. Click that notification bell. Hit that notification bell if you're on YouTube. We really appreciate it. Also, if you are an instructor and you feel this might be helpful for your students, pass it on. We encourage you to do so. And by the way, these cases are designed not just particularly for massage therapists. It's for therapists such as chiros, physios, physical therapists that have a strong emphasis on working with the soft tissues, fascia, and muscles. So in other words, these cases are designed so that you can actually apply what you've learned to these particular cases, whatever you learn in the classroom in regards to the soft tissues. So keep that in mind. Now let's go on to the key observations. The patient client has a kyphotic posture with a forward head position. Right shoulder seems more medially rotated. Tipping of the right scapula observed when patient client isn't prone. So scapular tipping is this mechanical issue that happens where the inferior angle of the scapula looks like it's kind of off the rib cage. So you tend to notice this like when the person's lying prone. That gives you a clue as to a particular muscle that could be super tight, that could be causing the tipping of the scapula. This, of course, is relative to the opposite side. You will notice this. It's an obvious thing that happens with scapular tipping. Forward flexion of the neck to the right side causes pain locally and down the arm. So this is the scaling cramp test. Whenever they do this thing towards the right side, they're noticing the symptoms down the arm. Going further into the observations, the special tests, military brace, aka costoclavicular, sorry for the misspelling there, I added another V, Eden's, Adson's, and right side hyperabduction show positive. So for myself, I like using McGee. Orthopedic Physical Assessment is, I think, what the textbook is called. And I'm sure you guys have tons of textbooks that you can go through. You can go online and look at these different tests. Maybe remind you of, review these tests that you may have learned in the past. When head and neck are flexed to the unaffected contralateral side, it causes pain locally of the right neck on the lateral side. So when they go to the opposite side, they're noticing that there's also pain on the side that they're complaining of. Pinpointed palpation into the right scaling triangle causes local sensitivity and pain down the arm. Pinpointed palpation just inferior to the right clavicle elicits radiating pain inferior to the clavicle and extends towards the biceps. So when I say pinpoint, I'm talking very, very precise points that you're sticking your thumb or your finger into. It's causing these symptoms. With these 2 points here, you probably will have to, if you're very good at your anatomy, you might want to just take a quick look at some textbooks if you just want to review anatomy textbooks and see what structures are around the area. So now, these are the critical thinking questions that I want you to think about. Remember, this is part 1. Part 2 will have more of the answers and discussion. So you'll have about a week to think about these questions, maybe write down answers, write down some notes. What do you think is the root of your patient client's issues? What are 3 muscles that are potentially implicated in this person's condition? Describe the mechanics of the 3 special tests, military brace, Adson's, and Wright's. And finally, why would there be a pain response when your patient client flexes their head to the opposite side? So these 4, you can take your time, jot down some notes, and hopefully when I see you in the next week, we can discuss the answers and discuss the case. So as I said, answers and discussion is typically a week after I put this video out. You can find it on YouTube or LinkedIn. So keep an eye on the follow-up video, part 2. We want to thank you for watching. We really appreciate it. Again, if you like our content, please like, share, subscribe. Pass it on to those that you feel this might be helpful for. Also hit that notification bell if you are on YouTube. Also, follow us on our social media, and also we have videos. We have our clinical videos, mainly for patients that are on ventepainrelief.com, and also we have another website. I'm saying all these alsos. We also have our pain relief website, pain relief fitness website, vprc.ca, that has techniques in regards to managing your own pain. So again, thank you very much. We really appreciate it. My name is Alfie Vente of Vente Pain Relief Clinic and vprc.ca. Have yourself a great day, and we'll see you in the next video. Take care.